release some incarcerated individuals as a safety precaution. That's a move District Attorneys Andrea Harrington in the Berkshires and David Sullivan in the Northwestern region recently called for as the country and world grapple to decrease the cases of COVID-19. Hampden County Sheriff Nicholas Cocchi told us the idea is, quote, ill-advised. He said that inmates are in a controlled and safe environment and need to remain there for their well-being. And while that proposed change from the DAs is not welcomed by Cocchi, he spoke with me about a number of other changes to the county's correction system because of this new coronavirus.
Some of the changes we've made that have immediately impacted our offender population are the restriction of all personal visits. And I thought it was important to do so because we're trying to continue to have the people in the community stay safe, but also keep the environment inside of our walls safe and healthy. Because as of right now, it's probably the safest place you can be. We have no known cases of any one of our 4 facilities that is even exhibiting the COVID-19 virus symptoms from an inmate population standpoint. And then from a staffing perspective, we're doing staff testing before every person comes to work, and we're asking them a series of questions. We're taking their temperature, and if we feel they've exhibited 2 or more of the symptoms, we're sending them home to go into a precautionary protocol before they can come back to work. So we've done a really good job of controlling every entry and exit point of the facility to make sure that we're controlling who goes in, and if they're going in, they're in the best possible health position they can be in to go in and provide services.
Now, just to be clear, when you said staff testing, you mean that that's sort of a system that you have determined, not testing for COVID-19, correct?
That's a great question. So we're doing staff questioning, and we call it screening, that could potentially lead you to a potential COVID-19 scenario. So, for example, do you currently have a sore throat? Do you have a cough? Do you have any other condition that is contributing to a cough or a sore throat? If the symptoms that they responded to positively dissipate, we'll have them come back, be screened again by our medical staff, and they can come to work. If the symptoms get worse, they're instructed to go to their primary care physician, and from there, we will seek further medical assessments and dialogue as to where they are and when they will be allowed back to work.
Are you conducting similar screenings of the inmate populations as well?
The exact screening process is in place for any new person that comes into our facility. And just so everybody knows, if you come into our facility as of a week and a half ago, you're going into specialized units that do not commingle with the pre-existing population that was here. So we have a very good handle on the safety and, more importantly, the health wellness of our offenders that have been here for quite some time. So, yes, we're providing the testing, and if somebody tests, or should I say, if anybody screens positive on some of these symptoms, we put them into a precautionary medical isolation.
Circling back to the visitation changes, as I understand it, that's a 60-day change, and clergy and attorneys are still allowed to come in and have visitation rights. Is that correct?
That is true. For professional visits, we are still accepting attorneys and clergy visits. However, when they come in, they will be masked to protect the population and to protect themselves and to protect the staff.
During the change in the visitation, do you think that you should adjust the policy for phone calls? As I understand it, there was a bill filed in January that would change the current law around phone calls and make phone calls free for inmates. Should those phone calls be made free temporarily while this is going on, since they don't have access to visitors or the outside world in that way?
Well, what we did is we took the visiting hours that any particular offender would have, which totals 2 hours a week. And since they've lost that contact for 2 hours with their loved ones or their family members or friends, we have given them 2 free hours of phone calls each week.
You said earlier no known cases of COVID-19 that you're aware of, but I understand from a release from your office last week, there was one person who did have some of those symptoms that are related to COVID-19, but could also be a cold. But as I understand it, you took the steps to quarantine that individual. You reached out to the Department of Public Health, and the DPH declined to test that person. Were you surprised?
Was I surprised they declined to test? I was a little bit, but as I got more educated in the process. The individual that we had, and again, it's preventative protocol measures that we had in our medical restrictive area. The symptoms were quickly subsiding. The individual was released from that protocol fairly quickly, and the person's actually not even here anymore. They actually went back to the community. So I was surprised when I first found out they wouldn't test, but knowing how hard it is to get the testing agent and to get a test done, I can see where they're screening them extremely closely, and they're screening how many cases they're going to test. And this person really didn't fit the script of having somebody be imminent to being tested for COVID-19.
What about the Centers for Disease Control has suggested that pregnant women, people who have exacerbating health conditions such as asthma, things like that, that could make them more susceptible to COVID-19, even people over the age of 50. CDC has recommended that these people could be high risk. What, if anything, are you doing to address this population?
Well, as the governor's put out orders for non-essential staff not to come to work, anybody who falls into a category that have compromised immune systems, are of the age of somebody who could be in a high-risk scenario, we have them at home right now. As far as the offender population goes, right now, our facility is probably one of the safest places you can be. It's clean. We have a very healthy environment in here right now. We have medical personnel that are within not minutes, but seconds from responding to any emergency that's needed. So we feel right now we have a great handle on the level of care that we're providing for our offender population. I would say anybody who has somebody who is doing time or incarcerated with us, they should feel very confident in knowing that that their loved ones are getting the best health care they can be getting right now.
What do supplies look like there for you, not only for staff, but also for inmates, whether that's soap or sanitizing products? Do you have enough?
As of right now, we are in good shape when it comes to food, resources, toilet paper, sanitizer, and the things like that. We are properly prepared as a facility and as an agency who has the care and responsibility of over 1,000 people. We never take that responsibility lightly, so we are properly stocked. Now, if this continues more than 40 or 50 days, that could put us in a position where we are now going to become scarce in resources, but we're already working on getting in replacements for what we're using now.
Have you been speaking with local hospitals or medical officials to talk about a plan that if someone in your care does come down with COVID-19, a protocol for transferring them or getting them the treatment that they need?
We're always in contact with the Department of Public Health daily through our medical staff. I have been in contact with some leadership in our local hospitals. They're doing a tremendous job. If we had somebody come positive with COVID-19, whether it be staff or inmate, we do have a plan in place. And quite frankly, the plan's not much different depending on their health than it would be if they had the flu. So we are very well equipped to handle it, to take care of it, to make sure we do our best job not to have it spread. And again, I really appreciate the time to talk to you because I really want to put people at ease when it comes to how is the climate inside the facility. The climate is excellent. The health of our offenders is excellent. Where the concern needs to be is exercising social distancing in the community and to exercise all the governors and the healthcare professionals' orders on what to do to slow down the spread of the virus. If we do that, we're doing our community a huge service. If we don't do it, we're going to see the need for hospital beds and resources go above what the community providers can take care of, and that's where it becomes critical.
The piece about preventative medicine, is that being paused right now just in terms of what would have been our routine physical, things like that, as it is for people here in daily life?
No, our medical and our preventative medicine and number of nursing visits and sick call visits is going on as normal. We have not altered our operations one bit other than stopping people from the outside coming in because we do not want to infect the climate that we have right now in the healthy climate we have now. So other than that, medical resources and doctor visits, and nurse visits, and sick call visits, and medication. All that is continuing as always.